Okay, today I'm doing an intramuscular injection. For intramuscular injections, there's 3 different landmarks you can do. So the first one is the deltoid muscle. So you want to find your acromion process at the top of the shoulder where the shoulder meets the arm. And you want to go about 2 to 3 fingers down from the acromion process. Create a V with your hand, and then right there at the bottom of the V is where you would do your injection. So for the second one, we're going to do the rectus femoris. So you'd want to find your symphysis pubis. You put your hand there, and then you put your hand at the top of the patella, thumbs at 90 degrees, lift your fingers up, and where your fingers meet, in the middle is where you would do your injection, so right there in the middle of the thigh. The third is the ventrogluteal. So for this one, my patient would be lying on his left hip, and so then I would be doing his right hip. So with his right hip, I'm going to use my left hand. And I would find the greater trochanter, which is about right there. And then I would want to make sure my index finger is at the anterior superior iliac spine, and then my middle finger would need to be at the iliac crest, which is the highest point of the hip bone. And again, I would do my injection there at the bottom of the V. So now I'm going to do my intramuscular injection. Okay, I've checked my patient's chart. I've done my rights. I have 5 rights 3 times. I've gathered all of my materials here. I'm going to wash my hands and put my gloves on just so that's done. Okay, so I'm going to get my syringe ready here first before I show you the site landmark that I've chosen. So I'm going to open my package here, take this out. I've checked the date and time on the vial already, and it's good to go, so that's good. And I'm going to clean my vial. Okay, going to take the cap off here. I'm going to draw back 0.5 milliliters of air. Okay, I'm going to insert 0.5 milliliters of air. Okay, going to invert it. I'm going to draw back 0.5 milliliters. Okay, and we're just going to make sure we don't have any air bubbles here, which we don't. We get rid of all the air bubbles. Okay, I'm going to take the vial off. I'm going to recap it. Okay, so the site I've chosen is the deltoid muscle. I've chosen that because with the deltoid muscle, you want to do less than 1 milliliter because it's easier access and it's less bruising. So we have 0.5 here, so that's what we're going to be doing. I'm going to clean the patient's skin inside out. I'm just going to leave this here so I can take my eyes off of it to take the cap off before I insert it. Okay. Going to take my needle here to take this off. And we're going to make sure the skin is taut before we inject it. And we're just going to put it straight in, inject, straight back out. I'm going to recap my needle, put it into the sharps container. I'm going to take my gloves off. Then I would wash my hands again. And I would document into the patient's chart that we did 0.5 milliliters of the influenza vaccine today.